Hey guys, name is Dr. Steve Oswald from Idaho Spine and Sports Physical Therapy. Recently had a question on when it's appropriate to see a specialist when you have knee pain. This is a relatively complex answer because the reality is it really kind of depends on a lot of factors on when you can just rub some dirt on it and walk it off, and when your orthopedic issue isn't really a problem, when you can seek conservative care, when you just need to see a primary care provider for just additional screening, and when truly you need to go to an orthopedic specialist for your care. If we're talking about kind of the latter, really the time to see the orthopedic specialist is when there's kind of known major joint deformity or tissue pathology that can't be solved otherwise. For example, we have known bone on bone architectural changes within the knee that has failed previous conservative care, and it's debilitating and painful. So when you're looking at maybe getting a joint replacement and you've failed other conservative means, that's definitely time to see a specialist for your orthopedic care. If you've had previous ligamentous injury, like you've torn your ACL and that's been screened already by other medical professionals, and you still report consistent buckling of the knee, that's a time to maybe seek the care of an orthopedic specialist. And if we've had some sort of a major trauma episode that hasn't been screened and we're still unable to bear weight in the leg, that's again a time to see either your medical provider or an orthopedic specialist too, because you may be dealing with a fracture or some sort of major trauma that requires surgical fixation or repair. So those are really the key big indicators. Otherwise, it almost results back to did you seek the appropriate types of care in the continuum that you should with almost any orthopedic condition, which is did you do some active things initially and modify your environment to improve your condition yourself for a short period of time? If unresolved, did you seek the care of your conservative team, like with rehabilitation and doing some physical therapy to address the structural problem? If you've truly failed at that point, seeking additional non-invasive or minimally invasive procedures like injections. And then after that's been exhausted, is really kind of the time for that surgical consult. So hope that's helpful. Obviously, there's some nuance to this question too, and everybody's a little bit different. So this is definitely not true medical advice. So if you have questions about this, definitely inquire further, and we'll be happy to help guide you in the right direction for those answers. Thanks.